Giving birth is one of the biggest joys a mother can experience, but for some, the time afterwards can be very dark.
Yeah, and Dr. Kristine Norris from Palo Verde Behavioral Health is here to talk postpartum depression. Such a pleasure to have you here.
Nice to be here. Thank you for having me.
So it's a very serious topic, but bringing light to it is very important because it's something that is treatable, maybe even preventable, right? So we'll get to that. And let's talk about what it is in the first place and how it differs from, say, baby blues.
Sure. So baby blues is a very normal part of post-pregnancy. It generally takes place in the first 2 weeks after birth, and it's usually caused by hormone changes that occur, sleep deprivation, all of the usual things that we expect after giving birth to a baby. But postpartum depression is much more severe than that. Outside of what we normally expect with depression, so depressed mood, lack of sleep, difficulty eating, one of the biggest things we notice in postpartum depressed mothers is that they will experience just an overall indifference to motherhood, or they will start feeling like they can't bond with their baby, they can't relate to the person that they just give birth to. And in addition to that, they can feel unusually irritable and usually anxious. They start to have these really dark thoughts that are very unusual for them, and they feel a lot of guilt.
Right.
Because it's, motherhood is supposed to be a very happy time in their life, and instead they feel this overwhelming sadness or indifference towards a milestone in their life that they've been looking for.
Right. I think you put a lot of pressure on yourself as a mom, especially right after you have a baby, and then everybody around you is expecting you to be super
happy. Absolutely.
Right. This has been brought to the forefront more so, I think, in recent years. So how common is this?
It's very common, actually. Up to 1 in 5 women will experience postpartum depression or anxiety over the course of their lifetime. And so it's important to be aware that it's, while it's not normal per se, it is very common, and that there is no shame in having the diagnosis because it is a very, very treatable medical condition.
Right. Yes.
And on that note, it has the word depression in it. Do you use the same modalities to treat postpartum depression as you would regular depression?
We do. We modify it obviously for motherhood. So, the usual things that we would use to treat depression is also what we would treat for postpartum depression. So therapy is very common. Sometimes we use antidepressants that may or may not be a lifelong course, so it can be very temporary. And of course, the big one though is very much acknowledging that being a mom is not automatic. It's okay to be stressed after giving birth because kids don't come with a manual. And just because you gave birth to your baby doesn't mean that you automatically know how to change a diaper or swaddle a baby or feed them, and those things may not come easily, and that's okay.
Right.
And so giving support to mom, making sure she's sleeping, making sure she gets help with the baby are actually very common and preventable ways to decrease the rate of depression.
And I think you can't say it enough. It's okay, it's okay, it's okay.
It's definitely okay.
Now, how does this get better, and how long does this typically last?
Everyone is different. For some moms, they find that, throughout their adulthood, they'll need to be on some sort of treatment for preventative reasons and also just for active treatment. But I would say for a good chunk of mothers, it's actually very much a short course. Sometimes it takes months. It may take up to a year or two, but most moms, actually all moms, get better in some degree or another. So seeking treatment is really, really important.
And so tell us how the outpatient program is actually going to help mothers and what that looks like for somebody.
So we're very excited at Palo Verde about offering these services to our pregnant and postpartum mothers because there's really not many out there in Tucson, and in general, just mental health care is not common, but especially for pregnant and postpartum mothers. So Palo Verde has started a program where we offer both therapy and medication management for pregnant and postpartum patients. It's a self-referral. We take all insurance. You don't even need insurance to come see us.
Who wouldn't want you as their doctor, too? You're so relaxed.
Thank you. I
Thanks for being here.
appreciate that. Thank you for having me.
If you'd like to learn more about the services at Palo Verde Behavioral Health, you can visit paloverdebh.com or you can call them at 520-322-2888.